Good afternoon, everyone. I'm Dr. Jazz Atwal, Deputy Chief Provincial Public Health Officer for the province of Manitoba. As you know, yesterday, Health Canada approved the COVID-19 bivalent vaccine, which provides protection against the original strain of the virus as well as the Omicron variant for people aged 18 and older. We are moving quickly to make the vaccine available to Manitobans, and today I am announcing the first groups of people who are eligible to receive it in our province. Based on expected vaccine shipments and public health recommendations on who should receive the vaccine first, initial eligibility criteria includes adults aged 65 and older, Indigenous people age 18 or older regardless of where they live, adults of any age with higher risk medical conditions, healthcare workers, and residents of personal care homes and other congregate living facilities, including group homes, shelters, and correctional facilities. Individuals must complete their primary series of vaccine before they can receive the bivalent vaccine. It is recommended to wait 6 months from the last dose of vaccine or COVID-19 infection. However, individuals who meet the criteria can receive the bivalent vaccine after a minimum of 3 months if they feel they are at increased risk. The bivalent vaccine can be given at the same time as other immunizations. This will include the seasonal flu vaccine once it becomes available this fall. More details on booking for bivalent vaccine boosters will be available next week. This vaccine is also being provided to First Nations communities for their immunization campaigns as well. In terms of supply, we expect to receive a shipment of 27,650 doses of vaccine next week, which will then be distributed to vaccine locations across the province. A second shipment of 77,600 doses is confirmed for the week of September 12th, and additional vaccine deliveries are expected in the following weeks. Based on supplies and initial uptake among eligible groups, we expect to be able to expand eligibility for the bivalent vaccine to all Manitobans aged 18 and older in the coming weeks. However, we will also be expanding access for a fourth dose or a second booster for all Manitobans aged 12 plus starting September 12th. But we encourage everyone to wait a few more weeks and get a dose of the bivalent vaccine when they become eligible. That's because the bivalent vaccine is expected to provide additional protection from COVID-19, providing broader protection against 2 different COVID-19 strains and a greater overall defense for Manitobans. As part of ongoing work to build capacity and support immunization outreach across the province, Manitoba's policies have been updated to allow pharmacists to give COVID-19 and seasonal flu vaccines to individuals aged 2 and older. I look forward to providing further updates about eligibility and supply as more information becomes available. Before I take questions, I just want to remind Manitobans of public health's advice to help reduce the spread of all respiratory and gastrointestinal illnesses as we begin to move indoors or return to school, work, and recreational activities. Most importantly, stay home when you are sick. Even if you are a little bit sick, stay home until your fever is gone and other symptoms have been improving for 24 hours. If you are sick, avoid non-essential visits to high-risk settings such as personal care homes, healthcare facilities, and non-essential contact with individuals at high risk of having severe outcomes. If you have COVID, we recommend staying home for 5 days and wearing a well-made, well-fitted mask for 10 days in total if you're going to be in contact with others. Whether you are sick or feeling well, it is important to continue to wash your hands regularly and cover your cough or sneeze. And now I will take questions. Thank you.
Does the wait change depending on when you've had COVID? Like, will that change anything?
So there'll be guidance provided on that. The recommendation at this point will be 6 months. If you're talking about the bivalent vaccine as well, it'll be 6 months is what's recommended, but we will drop that down to 3 months as well if the person otherwise meets eligibility criteria.
Canada's Public Health Officer, Dr. Tam, said last week encouraging everyone to be up to date on their vaccines, which includes getting the second booster, 4th dose. People in Manitoba under the age of 50 have had no access to that, and now you're asking them to wait longer, even if you do expand it to get this one. How can you explain the delay in making this vaccine that a lot of people would be past 6 months for? How do you explain the delay here in Manitoba for people to be up to date in protection and then have to wait longer?
Well, we're following NACI's recommendations on having a fall booster vaccination available. The data that's available with the science is there. Again, this all evolves. The highest risk individuals are those at risk of having a severe outcome. The idea behind a vaccine is to prevent those severe outcomes. That's what was the issue right from the beginning. Right from the beginning of the pandemic was those severe outcomes. It's not really about infection per se. Most people will get infection. Most Manitobans have had a COVID infection. Most Manitobans have done well. It is those that are highest risk that would be who we want to protect the most, and that's what we targeted our vaccine program in relation to that. We have a bivalent vaccine that's available, that's coming out right away as well, and that vaccine will provide broad coverage against not only wild type and the variants related to wild type, but also to Omicron and the variants related to Omicron. So the strategy here is to get those at highest risk in Manitoba, who we are targeting right now initially with our bivalent vaccine program, to get that dose to help protect them. Others are otherwise relatively healthy. We do recommend, once vaccine is available for that group, to also get that bivalent dose as well.
And when you say it'll be available to the broader Manitoba public in a couple weeks, what are we looking at? Is it an October date, November date?
That's a challenging question to answer. I mean, we have Moderna that's authorized by Health Canada right now. Pfizer has a submission for their bivalent booster to be available as well. So there's a few things at play here. I cannot commit to any specific amount of doses or timeframes, but in the coming weeks, we feel strongly, as long as those approvals are there, that most Manitobans 18 plus who want a vaccine should be able to access a vaccine in the next 6 to 8 weeks' time. You got to remember, when the vaccines come in, there's limited supply as well. So just like when we first got vaccine, it's not like we had 1 million doses to give right off the bat. We had a handful of doses or thousands of doses. We're going to target those. Even when the vaccine comes into the province, we have to distribute it in a fashion that's safe, where the vaccine is stored safely. We have to provide it to all the providers in Manitoba to get that vaccine into arms as well. So those are all processes that take a little bit of time. So again, you might not get your vaccine right off the bat, but in due time, in a short period of time, you'll get that vaccine. You will be protected. Again, the idea here is to protect those most at risk from a severe outcome, and that's who we're targeting with our initial uptake, with our initial desires on the vaccine rollout.
For families, the fourth dose will be available for 12 plus on September 12th. This one isn't for children. Should families, as kids go back to school and have all of those kinds of risk factors in their lives again, should they consider the fourth dose for their children?
So what we foresee is likely that, those 12 to 17 likely would have access to a bivalent vaccine, as long as, the vaccine is authorized for use there. So again, I would wait, I think it's best to wait for that bivalent vaccine. Now, for those that are really concerned, they can choose to get that second booster if they choose to, for their family member or for themselves, but then they would have to wait 3 months subsequent to get a bivalent vaccine as well.
Dr. Atwal, why is this bivalent vaccine the one that Manitobans should be waiting for when it targets BA.1 and we primarily have BA.5 circulating in the community?
So variants change. Right now it's BA.5. In 6 weeks it might be BA something else. When we designed the original type of vaccine, that was wild type, right? That was designed against wild type. So we think of that as a family. The wild type family included alpha, beta, delta. It worked well against all of those for severe outcomes. That's one family of viruses. This here, when we look at Omicron and wild type are like cousins. That vaccine that we developed for wild type did help out for Omicron as well. Now we have a very specific vaccine for Omicron. Yes, it's BA.1. I know there's other vaccines for BA.4, but all of those variants within Omicron, they're like brothers and sisters. So it should be just as impactful for those. And there's early studies indicating that the BA.1 vaccine works well for BA.4, BA.5. Again, this is all going to evolve. There'll be other variants coming as well. The bivalent will provide that broad coverage of what happened before, what was circulating before predominantly, to what's circulating now predominantly. And the more coverage you have, the more protection you have down the road for the next variant that may come.
Manitobans have been waiting, I guess, months for this, and are you worried that perhaps that is giving people the confidence that, that this vaccine is the be-all, end-all? How you mentioned it's going to help with in a lot of cases, but are we perhaps putting too much weight into this vaccine?
Well, every year we have an influenza vaccine program that targets those that are highest risk and is available to all Manitobans as well, because people still have severe outcomes related to influenza. We're going to run that campaign as well again this year. We have a COVID campaign right now. COVID is relatively new. We foresee COVID in some ways behaving like influenza, so we're trying to treat it as much as possible in the similar fashion. We have a vaccine that's available. There's no silver bullet here. The vaccine's available. It'll help reduce transmission. It should help reduce severe outcomes, which is what we're really going after. We don't want the deaths. We don't want the hospitalizations. We don't want the ICU admissions. This vaccine should do that. Again, something can change. It's really hard to predict that future. It's going to be really hard to predict what happens with COVID 5 or 6 or 9 months from now. But as the science evolves, our response evolves with that as well.
Are you suggesting Manitobans do more than get that vaccine? In terms of masking and other things at this point?
Well, again, public health has provided a lot of guidance to the public right through the pandemic. We provide guidance to, different sectors. In our team, we have epidemiologists, we have researchers, we have nurses, public health physicians, other types of physicians. We will work with local, national, and international partners as well. So all of our recommendations are based on a collective. So hundreds of people come and, make decisions and make advice for Manitoba. We provided education. I think at this point, most people know from an education standpoint what COVID is, how to prevent viral infections from occurring, what to do when you're sick as well. We have testing that's available. We have treatment options that are available. We have supports for people who need that related to isolation. We have a big vaccination program that is still evolving, and we're going to be adding on to it, obviously, as more vaccine becomes available as well. And we provide that ongoing support in all areas as well. So I think public health, from a masking standpoint, you asked specifically, do your own risk assessment. Right? If you feel you are at risk, then you should wear a mask. There's no harm in that. We shouldn't be judging people if they are wearing a mask or not wearing a mask. Everyone needs to do their own health assessment and risk assessment, as we have been saying, and make those decisions for themselves.
What do the early studies and research about this bivalent vaccine tell us about efficacy with respect to BA.1 and BA.4, BA.5?
So there's early studies related to its efficacy related to neutralizing or removing or lessening a severe outcome related to BA.1 or BA.5. The BA.1 studies versus BA.5, so similar laboratory analysis related to neutralizing antibody, it's called, so getting rid of the infection before it starts, let's say, or having that ability to do so in a lab. It works well clinically with the early data that's there as well to prevent a severe infection from happening. Again, the studies are early. There's going to be more information coming on a regular basis related to the effectiveness of the vaccine and of different types of vaccines with what happens over the next few months' time.
For the average Manitoban anticipating to get this vaccine who might not fall into a congregate living facility, how do you envision the rollout of this vaccine program? Is this going to be a go to your pharmacist? Is this, mass centers? What are you looking at right now if people are waiting with bated breath to get this booster?
I mean, first, I think we need to look at risk here. And if people are living in fear, they shouldn't have to live in fear. One shouldn't fear what's happening right now. What we've done and how Manitobans have responded, we know serologically through blood samples through all of Manitoba that 87.5% of Manitobans have had a COVID infection. Over 96% of people have an antibody response to whether it's an infection or whether you responded to the vaccine. So there's broad coverage related to COVID out there in Manitoba. We're going to target certain areas, so like public health will work with long-term care to provide vaccine there, but this vaccine will be available through regular channels. So just like you're getting your vaccine right now is how you should be able to get that vaccine, the bivalent vaccine going forward. Again, there will be limited supplies early on. Don't fret if you have to wait for your appointment for a couple of weeks or even 3 weeks or 4 weeks. It's okay to wait. It's okay to wait for that appointment. The important thing here is when that vaccine is available for you, book your appointment and get that bivalent vaccine. I think that's the strongest message we want to bring forth from public health.
How can you describe the COVID spread in the community right now? I mean, all we get is the epidemiology reports. ICU numbers are up. It says increasing activity each week. What really is going on?
Sure. It's a virus. It's out there. People are getting COVID. You could talk to businesses. They have awareness on how many people have COVID within their business who are testing. We have hospital data showing people have infections. Again, people get infections. People recover from infections. What we want to focus on is not the infection. Most people get infections. You have a cold. Before COVID, people got colds, right? A lot of people got colds. Colds went around. Most people did well. Some people still ended up in hospital back then. That was a severe outcome. We didn't do anything different then. There's no vaccines available. There's no real treatments available back then. There's such a focus on infection right now occurring, but it's okay to get infected. You're building your natural immunity, so that's good. We have spread in the community. That's okay. What we aren't seeing is the severe outcomes to the extent that they were there previously with the wild type or with Alpha or Delta. And that is because Omicron became less aggressive, caused less severe outcomes, but also because we have such good vaccine uptake that we're getting that cross coverage to help prevent severe outcomes from happening. So the focus should be on severe outcomes. It shouldn't be on the actual how many people have an infection. Really, that does not help the situation at all.
What about the hospital system? The first time around when we rolled out vaccines, it was all about protecting the space in the hospitals.
Right. So our hospitals were stressed. I've been in medicine since 2002. They were stressed back then. We've had stresses every year in the hospital. We've had stresses specifically in certain seasons related to influenza in the hospital. It's going to be busy in the hospital. It's busy right now in the hospital. It's going to get probably a little bit busier coming this fall. More people will get sick. There's going to be other viruses circulating as well, specifically influenza or RSV, and we're going to have hospital admissions related to that. The amount of COVID clients that are actually in hospital for COVID reasons is actually a small number. It's a fraction of what we have listed online or what's available. And that's because it's the way we capture cases. We could put a lot more effort into identifying who exactly is in hospital for COVID and give an absolute number, but that's labor intensive. That requires taking doctors and nurses away from other duties to perform an administrative function. So we do that at random to see what's happening. And from our numbers, if the number in ICU today, let's say is 10, I don't know if that's the number today, but let's say that number is 10, realistically only 2 are there because of COVID, but 10 are listed as COVID positive. So it's a fraction. So, the vaccine, the treatments, all protect our acute care system. So we're going to continue to stress the importance of accessing those vaccines, getting that vaccine when it's your time, making sure that if you are sick, go get tested. If you could access treatment because you're higher risk, go get that treatment as well. So there's a lot of modalities here that we've gained over the past 2 years' time, 2.5 years' time to protect all of us, to protect ourselves, our family, our community, and our healthcare system.
Do we have modeling for the fall? And if so, what does that look like? And can we see it?
I don't have any modeling to share at the present time, so I don't have that modeling.
The way that
One or two more here.
The way that you're speaking about COVID now really seems like there's an approach that's looking at it endemic rather than pandemic. Is that where you're taking your lead now? Does it feel like we're moving into the endemic stage?
I think we signaled that a long time ago as well, that, COVID is here to stay. It's going to evolve. You'll have different types of variants. The question is, does it happen in a seasonal fashion or does it stay all year round? Right now, it's basically been here on a regular basis for the past year or two. Will it act more like influenza where you get that seasonal variance? There's some questions we don't know yet, but likely, yes, COVID will be here. There'll be different forms of COVID going forward, and it's likely here to stay just like influenza is.
Uptake for the vaccines, though, has been low. We've been promised sort of a fall promotional campaign. How is the government going to promote vaccines and get them into arms?
So we are promoting vaccine. We're coming out here talking about a bivalent vaccine. There'll be a lot more done on the communication side from public health in relation to vaccines, vaccine uptake. We're going to have a lot of different resources out there providing that vaccine. So again, all of our healthcare providers, pharmacists should be talking to their clients about vaccine. I think that's a duty on their part to do so in every interaction that they have. We're going to have outreach programs to reach individuals who have tough time accessing, regular healthcare per se. So we're going to have a wide variety of mechanisms and ways to go get vaccine into arms and continue to provide that education, continue to provide updates to the public as well.
Also, your outcomes with BA.5, is there any signal, at least in Manitoba, that it is causing more frequency of severe outcomes compared to earlier strains?
Compared to?
Like BA.1 for...
Yeah, I would say it's static. It would be relatively the same. We haven't looked at that specifically in that much detail. Most of the cases in Manitoba are BA.5 right now. And again, we are seeing limited impact on the acute care system there. I'm not saying there is no impact. There is impact, but it's not like it was, and it is limited.
All right, thank you very much, folks.
Thank you.